The hardest thing for a human to overcome is themselves, but when yourself is no longer the one to overcome, the real challenge begins. Addiction changes you, literally. It controls you by changing how your brain works, and you be no longer in charge of your decisions. This is why it's super hard to overcome. It's a chronic disease that needs a mix of risk factors and causes to occur. Not everyone can have this disease. For the ones who have it, the majority of them aren't chasing a pleasure, but are escaping something, which can be an environment that gives them emotional stress, a social circle with toxic people, lack of self-esteem, loneliness, trauma, or a grief that left an emotional weight so hard to be bared. About the risk factors that anyone can have, even though not having trauma or stress. They can be genetic vulnerability. It's when someone is genetically disposable of genes that code for less dopamine receptors in the brain. That means their natural reward system is understimulated, since more dopamine receptors equal more dopamine getting inside, which is more satisfaction. For these genetically vulnerable people, the everyday satisfaction to basic things is decreased. So, if they use a substance, their brain receives a huge amount of dopamine that forces these few receptors to fire up and get their reward it has been starved to get, which means they are naturally prone to getting addicted more than others. Another thing is early onset, which is when a teenager uses a substance while his prefrontal cortex, the one responsible for logic and decision making, is not fully developed. Since it completes its development mid-20s, later on it gets even harder to make a logical, beneficial decision because the engine to do so is damaged. Another risk factor and a cause at the same time is socio-environmental stress, which is using a substance to calm a chronically stressed or overwhelmed nervous system in order to calm it down rather than feeling euphoric or high. Since stress causes spikes of hormones that induce the fight or flight, substance here acts like a switch off to balance out the mood and protect the body. Clinically, these regulators can be prescribed as anti-anxiety medications or antidepressant ones. By using street drugs or alcohol to stabilize that mood would mess up the nervous system in the long run. After the addiction cycle takes place, the exposure, the negative effects, and the dependence, the consequences start to appear. One structural result that comes with the chronic use is the prefrontal cortex erosion. As we said earlier, it's responsible for decision making. So what happens is the gray matter gets damaged by the toxic and chronic use of substance, and it can no longer integrate the logic and control impulsive decisions. It's like the brakes are gone physically. Not like that person doesn't want to stop, they physically can't. Now, when addicts just start, the substance they use gives them positive reinforcement, which is satisfaction and euphoria. That represents the liking phase. And then there's tolerance, and after a while it becomes escape in physical and emotional pain rather than pleasure. Why is that? Because the reward system burns out and no longer gives basic satisfaction for daily actions. This reward system is made of the VTA, the NA, and the prefrontal cortex. The VTA produces the dopamine, the NA is the one responsible of triggering the feeling of reward, and the prefrontal cortex makes a plan to get that reward again. So when this system is out, it creates a state of inability of feeling pleasure at all. It's known as anhedonia, which means the Greek without pleasure. After that, the whole thing shifts to negative reinforcement, which is explained by taking the drug to temporarily escape the bad feelings and suffocating mental state and the physical pain. This happens because your body naturally activates an anti-reward system to pull you back from that extreme feeling good phase. So the blood flows now with dopamine, endorphins, and stress hormones, and when the drug leaves the system, these stress hormones are still there and they cause pain, cramping, and muscle tension. So when this state is chronic, the physical pain and the mental pressure are the main reasons to take the substance, to reduce that pain and feel slightly normal before it all goes back down. It's not about the pleasure or escaping a mental state no more. It's about escaping the unbearable ache all over the body. This became an essential need, same as air or water. Now, what does the chronic use of drugs cause physically? The brain gets reshaped. Willpower would save no one here. First off, The brain produces proteins. They are expressed temporarily when you do or take something pleasurable, let's say, and they're broken down after a little while. But there's one protein called delta phosphate, which is the same as these proteins, but the difference, it's really resistant and lasts longer. So when the substance is taken, a little bit of delta phosphate is produced and it stays there while it builds up after each dose. Since it's not eliminated, as we said, after a certain amount, it builds up. It creates a genetic switch, which happens because delta phosphate has the ability to change how DNA is read and so transcribing proteins, and that reshapes the brain to make it hypersensitive, a huge craving machine to the substance. This explains the symptom of relapse that happens even after a long period of being clean. The delta phosphate and its effects are still there. Second, these toxic chemicals damage the prefrontal cortex, which, as we said, is responsible for the logic and the decisions. This is observed when the brain cells get starved and they eventually die over time, which causes physical shrinkage due to the loss of gray matter. This is responsible for the consciousness to stop being the reason, but it's the physical inability. Now, reconstruction. Before psychological treatment, the biosystem must be stabilized first. In pharmacology, there are agonists and antagonist agents. The agonists act the same as the molecule we want to substitute, while the antagonists act by blocking the action of the molecule we want to inhibit. So agonists like buprenorphine and methadone give the same result, but they act differently. They stimulate the action of the drug on the receptors, not to give any high, but to keep them open in a settled and a controllable way. They last longer too, and when they fade out, they don't cause strong withdrawal, unlike when the street drug is out of the system. Antagonists are used alternatively to block these receptors completely, so they act like a shield, protecting from any street substance. But if it's taken while the system has a drug already, it can be very dangerous and cause massive withdrawal symptoms. After that, therapy takes place to help the patient acknowledge his problems and try to fix them without harming themselves in the process. If you find that your environment, as in your friend circle, school, or job, is stressing you out, giving you insecurities, or making you doubt yourself in any sort of way, you should leave. If you're lonely or feeling left out, try reaching for new connections and make sure it's healthy. There are lots of people in this world that are nice and would treat their friends and loved ones the way they deserve. And if you're going through something hard or you feel traumatized by anything, you have to seek help and not be ashamed of it. Therapy can solve a lot of problems before anyone can take other paths they will regret. Relapse. First, relapse is not a moral failure, it's a symptom, okay? Over time and with chronic use of drugs, the hippocampus, the amygdala, and the striatum build strong memories related to the drug. The friends, the places, or the objects that used to be around the addicts while doing drugs all become strong triggers. And with the powerful trio we just mentioned, the prefrontal cortex, responsible for decisions, gets bypassed. If it's not already so damaged, it doesn't function correctly anymore. So relapse is so expected. You just need to go on with the treatment and you will get through it.